Welcome to the Master Clinical Dentistry Institute. Master Clinical Dentistry Institute provides the best mode of online learning, provide the best mode of online coaching. Spotlight features are we have 50 plus super specialized faculty members who are excellent in their subjects. We have 5,000 plus students who are connected with the institute all across the globe. You can go for 1:1 coaching or batch study. We have live online classes. You can study from anywhere around the globe, flexible hours. You can study from your home. So, the question which was posted previously was which of the following is most significant in regard to the prognosis of a periodontically involved tooth? Options are A. Pocket depth, option B. Attachment loss, option C. Anatomical crown length, and option D. Bleeding on probing. So, the answer was option B, that is attachment loss. So, here is the explanation regarding the question. Attachment loss is much more significant than periodontal pocketing. Actually, it is the most significant factor because with the attachment loss, supportive structures are being destroyed. Pocket depth is the distance between the base of the pocket and the gingival margin. The level of attachment, on the other hand, is the distance between the base of the pocket and the fixed point on the crown, such as cemento-enamel junction. So, changes in the level of attachment can be caused only by gain or loss of attachment, and thus they provide a better indication of the degree of periodontal destruction. The two most critical parameters for the prognosis of a periodontically involved tooth are attachment loss and the mobility. So, in periodontology, factors often considered in the generation of prognosis include tooth type, that is, whether the tooth is incisor, canine, premolar, or molar. Then, second factor involved is the furcation involvement, bone loss, that what is the actual bone loss, and then factor is the probing depth. Another factor is the tooth mobility, the occlusal forces, that whether the occlusal forces are normal or abnormal, which are there on the periodontium. Then patient's home care, patient's motivation, that whether patient is maintaining oral hygiene or properly or not at home. Then presence of any systemic diseases and cigarette smoking. Prepare for your ADC exam part 1 with Master Clinical Dentistry Institute. Clear your exam with vibrant colors. Expertise yourself in clinics with various clinical courses offered by Master Clinical Dentistry Institute. Pass your BDS examination with Master Clinical Dentistry Institute by various courses provided by the institute. For details, visit www.masterclinicaldentistry.com. You can call or WhatsApp +91 788 909 3147. You can like, comment, share, and subscribe our YouTube channel too.